Well, of course, February is a Heart Health Awareness Month. And today on our Medical Monday segment, we want to talk about those cardiovascular catastrophes. You think of heart attack, you think of stroke, but you don't necessarily think of heart failure. And it affects more than 6 million people, and 10% have advanced heart failure. So to talk a little bit about this today, Dr. Oliver Abella is joining us, who is a board-certified cardiologist with AdventHealth, to talk about life-saving treatments and to educate us even more. Dr. Abella, good morning. How are you today?
Good morning, Allie. Thanks so much for having me.
I'm glad we're talking about this. February is the perfect time to kind of reevaluate. And I'm guilty of this too. When I think of heart health, my mind goes to, the catastrophes, as I just said, heart attack or stroke. But really, heart failure, I didn't realize the numbers were that high.
Absolutely. And you're not the only one because it's something that comes along after a lot of other heart conditions. If you have a bad heart valve problem, if you have a bad heart attack, if you have bad heart arrhythmias, eventually those things lead to heart failure itself. And bad heart failure carries a worse prognosis than many advanced cancers. So it is a big deal.
So this may sound like a very simple question, but then what is heart failure?
Sure. And the answer to that is also simple, but it's a simple answer, but it's a complicated thing to deal with. But essentially, it's the heart not being able to provide the proper blood flow to the rest of the body. And we start to see that affect the major organs like the kidneys and the liver. And the individual will notice it as not being able to do normal activities without getting significant shortness of breath. That's something that is the first sign of it. But at times, it's difficult for that person to present to the hospital or to a physician to be evaluated for that.
Well, let's talk about some prevention. What do you see in your office? Does this affect, both men or women equally? Especially with this month talking about heart health, what are some things that we can maybe do?
Sure. So heart failure affects both men and women very frequently.
Oh.
And we've all been to the physicians and someone will say, hey, your blood pressure is running a little high. Maybe we should be on top of that. And the reason why all physicians are trained to make such a big a deal of those things is because eventually many of patients with uncontrolled blood pressure develop heart failure. And when that happens, we've lost a lot of ground to help somebody avoid major cardiac diagnosis.
So if you get that diagnosis, I'm kind of glad you talked about, watching high blood pressure first, but say you've already been told you have that. What do you do? How do you work with those patients?
Sure. So just like we've talked about in the past, doing the right things with diet and exercise, but also using the medications to keep those blood pressures in the normal ranges, that reduces the chances that you develop heart failure down the road drastically.
Well, Dr. Abella, I'm so glad we were able to talk about heart failure because, again, when I'm guilty, when I think of heart health, my mind goes to, the two other categories. So is there anything else you would like to add for people who are watching at home? Is it if you get high blood pressure, go see your doctor? Or what are some of those things that you would like to leave our audience with this afternoon?
Sure. So just like we talked about, it's extremely common. It can be a very significant and important diagnosis to treat. Something that my colleagues and I and our team work very hard at is making a customized plan for the individual, because there's a lot of different causes of heart failure. And so there's a lot of different ways that heart failure should be treated. And I feel like we're doing a very, very good job for patients, treating the individual the best way that we know how, whether that be with a procedure, with the medications, a combination of such. And that's something that we work very hard at, and we're very happy to be making headway in.
Well, I'm happy that you decided to join us today so that we could talk about it. Of course, you want to be sure, share the website, AdventHealthCardiovascularInstitute.com is where you can go for more information. And Dr. Abella, it was nice meeting to you today, and thank you for taking the time to join us.